Type 1 diabetes causes and symptoms. Causes of type 1 diabetes. Type 1 diabetes is an autoimmune disorder where the immune system mistakenly attacks and destroys insulin-producing beta cells. In the pancreas, the exact is not fully understood, but genetic factors and environmental triggers such as viral infections are beginning to play a role. Unlike type 2 diabetes, type 1 diabetes is not associated with lifestyle factors. Symptoms of type 1 diabetes. Number 1 is excessive thirst and hunger. Increased level of blood sugar led to dehydrations, causing excessive thirst. This body may also receive food to complete or compensate for the ability to use glucose for energy. Number 2 is frequent urination. High blood sugar levels prompt the kidney to expel excess glucose into the urine, leading to increased urination. Number 3 is unexplained weight loss. The body starts breaking down muscles and fats for energy since glucose doesn't enter cells without insulin. Number 4 is fatigue. Without sufficient glucose for energy, individuals with type 1 diabetes may feel constantly tired. Number 5 is blurred vision. High blood sugar levels can affect the lenses in the eyes, causing vision problems. Number 6 is irritability. Fluctuations in blood sugar can impact mood, leading to irritability and mood swings. Number 7, ketone presence. In several cases, the breakdown of fat for energy can produce ketones, leading to conditions called ketoacidosis or diabetic ketoacidosis, characterized by abnormal pain, nausea, and vomiting. Stay happy, stay healthy, stay safe.